Hi, hello, and welcome to yet another case note discussion. So in this video, I'm going to present before you a replication of the case which has appeared in the most recent OET exam held on 8th March 2025. Here is the case note. You can see the basic details given here, patient details, the social history of the patient, then the medical history, medications, present medical history. You can see in present medical history, you can see the first date as 2nd Jan. Then you have the objective data, the management given. Then a second date, 6th Jan, plan and the writing task. Now, as we all know that the total duration of the writing test is 45 minutes. In that you have initial 5 minutes, which is the reading time, during which the candidate will not be allowed to touch the pen or pencil, but just read through the writing task and the case note and have an understanding of the situation. So I'll just give you a quick overview of this case note. First, what we need to read is, we have to understand what the writer's role is. So it is given here, you are a nurse in the emergency department. Okay, then you immediately jump into the last part, that is the writing task. The writing task, from the writing task, you understand that you have to write letter to a practice nurse, and what is the requirement here? The requirement is requesting continuing care for the patient. And after reading the writing task, we read the plan to get a better understanding of what exactly the reader has to provide the patient. So from the plan, we understand that the reader needs to provide regular follow-up for wound checking and dressing, then suture removal, you can see. So basically it's about wound management. The practice nurse has to provide wound management to the patient. Now, by the end of this 5 minutes of reading time, we might not be able to recall all the details that we have gone through, but at least we should be having answers to these basic questions: who the reader is, what is the requirement of the patient from the reader, and what is the current situation or the current problem of the patient. Now, the answer to these first two questions, who the reader is and what the requirement is, it's quite easy, directly, straightforward it is. From the writing task, you can understand, because it is very clearly given in the writing task that you have to write a letter to a practice nurse, and the requirement is also given as continuing care. So we get answer to these two questions, that is, the reader is a practice nurse. Now, practice nurse, you should not get confused with who a practice nurse is. More or less similar to that of a community health nurse. Practice nurse is a nurse who works with a GP in a medical practice or in a GP practice and provides a wide range of services like immunization, then wound care, and management for chronic illness. These are the services provided by a practice nurse. Now, the requirement, yes, we have understood it is continued care. For continued wound care, we understand from the plan that the patient has got some sort of wound, and it is for that wound this practice nurse has to provide care and management. Now, regarding the current problem, we are not very sure. By the end of 5 minutes of reading time, we might not have a complete clarity on what exactly the problem is, but we might have a vague idea. We can understand that the patient has got a wound, and the detail or the exact detail regarding the wound we are not really sure about. So keeping this in mind, that who the reader is, that is, it's a practice nurse, and what the requirement is, who the reader is and what the purpose is. Now we are going to do a deep analysis of the case note to select the data accordingly, which will match with the reader's requirement. As in, what all details need to go out to the reader, you should be selecting them from the case note accordingly. So we know that we are going to write letter to a practice nurse for providing continued wound care to the patient. For this purpose, which all information from the case note would be relevant, now we are going to see and pick them. Okay. Now we get back to the beginning of the case note. So keeping this idea in mind, who the reader is, that is a practice nurse, and what is the reason for writing the letter requesting continued wound care for the patient. For this purpose, which all information would be relevant, that we are going to decide now. Today's date, of course, we need to begin the letter. We need this note. Then moving on to patient details. Patient name, of course, it is relevant. Date of birth and age, both are given. We need not, or we should not be selecting both of them. Either one we can opt for. So let's go with date of birth. Then from social history, widow, lives alone. Now it's not a home visit, and it's just we're referring to a practice nurse for providing wound care and management. For that reason, widow and lives alone is not a significant information. So we can consider it as irrelevant. Daughter lives abroad, again irrelevant. Yoga and daily walking, irrelevant. Then habits, alcohol consumption 2 to 3 units daily. We know after the 5 minutes of reading time, we have an idea that the patient has a wound, and to help in or this habit of alcohol consumption can have an effect on this wound healing. So as a supporting detail, maybe we can consider it as a semi-relevant detail, not a relevant detail, and we cannot totally consider it as irrelevant also. So let's categorize it as semi-relevant. Now the next one, moving on to the medical history. The first point is myomectomy due to uterine fibroids. It has no connection, no association with the current status of the patient, so it can be considered as irrelevant. Then osteoarthritis in right knee, which was diagnosed in 2017, and osteoarthritis in hand joints 2019. And towards the end of the case note, during the 5 minutes of reading time, again another thing that we would have identified would be that the patient has a wound on her knee. So for that reason, and now the patient already has this arthritis, so this should be considered as a relevant detail. So osteoarthritis in right knee, even though it's not necessary that we mention about the osteoarthritis in hand joints, it's not that relevant, maybe semi-relevant. Osteoarthritis in right knee is an important detail to the reader. Uses walking aid, of course it is relevant. Then regarding the medications, that the patient takes paracetamol 3 times daily and ibuprofen as required. It's again for osteoarthritis. Now nothing regarding medication compliance or monitoring of medication, it's not there in the plan. It's not something which the practice nurse has to do, but even then the patient is taking these medicines for osteoarthritis. So as a supporting detail, as an additional piece of information, you can update the reader. There's nothing wrong if you mention it, but it's not very relevant also, so we may consider it as a semi-relevant detail. Then coming to the current happenings, the recent happenings, present medical history, the first date you can see is 2nd January 2024. Now what has happened? The patient presented with laceration on right knee, fall on rock surface, forgot walking stick. So we understand that this patient who has osteoarthritis and who has been provided with a walking aid had a fall, and she had come to a facility with a laceration on the right knee as she had forgotten to take her walking stick, and she had a fall on a rocky surface. So this detail is relevant. That is the beginning of the story, how the patient came to us. Okay, so this is relevant. Now here it is mentioned forgot walking stick. So this walking stick plays a crucial role in the story, and therefore this uses walking aid here. In the medical history also it is given, which means that that walking aid, that element should come in the letter. And why this patient is using walking aid? Because already the patient is 71 years old and the patient has osteoarthritis in the right knee. So of course that we again just reinforce that information is relevant to the reader. Now bruises on right knee and thigh, okay, we may consider that. Pain 6/10, just I'll show you the next portion, or the details of the second visit on 6th Jan. Nothing has been mentioned regarding pain, So even if we don't consider it as relevant, that is fine, because we need not focus too much onto the presenting complaints and details. Because the writing task, I'll show you the writing task. What does the writing task say? The writing task say that you have to give information about the condition of the wound, the current condition of the wound, what the status of the wound is, and the treatment provided. So you need to focus on these areas, which means that the area which you can compromise on is that the presenting complaints with which the patient came to us. Of course, you have to provide a starting to the story, how the patient came to us, but not the very minute details like what the pain score was. All those details you can avoid. So pain 6 out of 10 is irrelevant. Then moving on to the objective data. So on assessment, what we found that the bruises on the right thigh radiated from knee. The patient, she had bruises on the knee and which had radiated to the right thigh. Okay, maybe you can consider that. Then laceration, of course, it's 4 centimeter. It is given the measurement of the laceration. That is also important because in the plan we saw about a suture removal. So it will be associated with this lacerations. Of course, we have to consider that. Then sand particles in wound. We saw that towards the end we see that the wound is contaminated. So we have to mention this aspect. Then BP 120/80, pulse 82, temperature 98 degree Fahrenheit, all this are normal. So we can ignore it. That is irrelevant. Now moving on to the management. So far what we have understood, the patient who has this background of osteoarthritis on the right knee and who is taking pain medications and who's using a walking stick had a fall on a rocky surface and presented to our facility with laceration and bruises. And when we assessed, we saw sand particles in the wound and the laceration was 4 centimeter deep. Other vital signs were normal. Now the next portion is what management we provided to the patient. Now this section is important because the writing task says that you have to outline the treatment provided. So this is important. Wound swab sent for test. Of course, we have to say that. Sand particles removed using low pressure irrigation. That is also relevant. It's a part of management. Then again, after removing the sand particles, what you did? You have applied antiseptic cream and provided waterproof dressing. Again, it's relevant. Then you prescribed antibiotic, cefalexin 500 mg 3 times daily for 5 days. That is relevant. Then tetanus was provided, tetanus immunoglobulin. That is also relevant. And you also advised leg elevation to the patient, which means that all of these details from the management or the treatment part should be there in the letter. All are relevant. Then the patient has been or was scheduled for a review on 6th Jan. Now let's see what happened on 6th Jan. That is today. It is the day on which we are writing the letter. So today when the patient presented, wound healing progressing well. Okay, so the writing task also says that you have to talk about the condition of the wound. So this is of course a very relevant information. So since the wound healing is progressing well, what you have done, you have sutured the wound and provide vapor permeable dressing. So that is also relevant. Now the wound swab, when the patient initially presented to our facility, you had taken the wound swab and now the result of that wound swab test is shown here. It has turned out to be positive for bacterial contamination. So that is also relevant. It's an infected wound. The reader has to know that. So that is relevant. And so for that reason, you have asked the patient to complete the course of antibiotic. In the first visit itself, you have prescribed a 5-day course of antibiotic. Now the patient has represented after 4 days, and after the confirmation of this bacterial contamination, you have advised to complete the antibiotic. Then again you advise the patient to continue using the walking aid, and the patient was advised not to take baths. The patient can take showers but not bathing. Okay, and moving on to the last part, that is the plan. From the plan, All of these points are relevant to the practice nurse. Regular follow-up for wound checking and dressing. Of course, it is to be done by the practice nurse, so it is relevant. Then suture removal after 14 days as per wound healing. Now, this aspect you have to take into consideration. You cannot simply say that the suture needs to be removed after 14 days. No, you have to take into consideration that only if, depending on the status of the wound, if the wound healing is satisfactory or fine, then the suture may be removed after 14 days. So these 2 points from the plan are also relevant. Now we have gathered all the relevant details which are to be included in the letter. Relevant details and a few semi-relevant ones and somewhere irrelevant. Now the next step is we have to decide on how to arrange them in the letter. We have got all the details, all the information to put into the letter. Now how to place them in the letter? Of course, we know that the first paragraph, we have the introductory paragraph, which is the purpose paragraph. Then followed by that, we start telling the story of the patient. Now in this case, we can consider 2 ways. Either you can start with the presenting complaint, the details of the first visit on 2nd January. You can say why the patient or how the patient came to your facility, then what you noticed, what management you gave to the patient, then the details of today's visit, and then in the next paragraph you can brief about the medical history and social background if there are any relevant details. But a better version, what I would suggest is that since this patient has this profound background of osteoarthritis on her right knee and she is using walking stick and using analgesics for the same, and now the patient had a fall and she has injury at the same spot. So it will be better if we can start off with that background of osteoarthritis. That is, after writing the purpose paragraph, in the expansion paragraph, in the first line you can mention that this patient has a background of osteoarthritis in her right knee and she uses a walking aid. And then you can say that in the same paragraph continuation, you can say that on 2nd January, she had a fall on rocky surface as she forgot to take her walking aid. So that shows the link to the reader. It will be more logical. The reading becomes more logical there. But even if you write the social background and the medical history as a separate paragraph, there's nothing wrong in it. But my personal choice would be like if you can start off with the osteoarthritis aspect in the first 2 lines and then come to the present complaint, then it would be better. Now, so we have got answers to the questions the reader is a practice nurse requirement and the current problem. Now what we can understand is that the patient has an infected wound. Now considering the current problem, when we had this discussion with the students after the exam, some had the feedback given by some students were that like they had a confusion regarding the diagnosis. So while writing the purpose paragraph, now the purpose paragraph is really crucial. That is what that provides the kickstart to our letter. So while writing the purpose paragraph, generally students know that they have to consider who the patient is, what is the requirement. What is the requirement? It's easy to identify from the writing task and the plan together, and what the problem is. Now what the problem is, mostly they look for this word diagnosis. If they notice this word diagnosis, they pick it up directly and put it into the purpose paragraph. But that should not be done blindly. We have to identify what the requirement is. What is the requirement as per the writing task? And we have to fix the current problem which aligns with that requirement. So here it is for continued wound care. And why the patient requires continued wound care? Even though in the last bit the patient shows signs of wound healing, the swab culture has turned out to be positive. So this infected wound should come in the purpose paragraph. If you mention about suturing, that is fine, but what is more important is this infected wound should be there in the purpose paragraph. Now with this idea, I'll show you some sample purpose paragraphs. Okay, now keeping these ideas in mind, I have crafted 3 variations of purpose paragraph. Now the first one says this is to refer Mrs. Judith Crawler, a 71-year-old with a sutured right knee wound which tested positive for bacterial contamination. She requires ongoing care. So in this sample or in this variation, both the suturing aspect and the infection have been mentioned, and the requirement, of course, ongoing care. Now we can look at another variation which says that I'm writing to refer Mrs. Judith Crawler, who has been diagnosed with an infected wound and requires continued care. Here also this variation is also fine. You've mentioned about the infected wound, which is the current problem of the patient, and the requirement continued care. Then yet another variation which says that I'm writing to request wound care for Mrs. Judith Crawler, who has an infected wound on the right knee. All the variations are fine, but the one thing that you have to ensure, where if you are confused regarding what should come as diagnosis in the purpose paragraph, don't just focus on the word diagnosis. Try to identify what is the current problem of the patient for which they have been asked for requirement in the writing task. In the writing task, obviously they'll be mentioning what is the requirement of the patient from the reader. So you have to scan the case note to find out what problem of the patient has prompted for this requirement. So as per this case note, we understand that it is the infected wound of the patient which actually prompts the requirement of the requirement from the reader, which is continued wound care, wound dressing, wound monitoring, plus an additional removal of sutures is also there. So if needed, you can mention about the sutured wound in the purpose paragraph. Even without that, it is fine. What needs to be there is, of course, this infected wound. I've just included the purpose paragraph here. So what I'm looking forward to is complete, fully developed sample letters from your end, which you can post in the comments. Hope you found this video helpful. We'll be back with more such videos. Stay tuned. Thank you.
Medcity International Academy. Trusted hands forever.